Time now, 7:21. Over the summer holidays, many parents will have tried to keep their children busy and entertained, but sometimes they'll still end up in front of the TV.
Research from Public Health England suggests that children who spend a lot of time in front of a screen are more anxious and distressed.
So, as a new school year is about to begin, parents are being encouraged to make some changes. Joining us now, anti-poverty campaigner Jack Munro, who has a 3-year-old son, Dr. Ann Hoskins from Public Health England. Very good morning to both of you. Dr. Ann, first of all, tell us what it is you're saying in your report today.
Well, it's a report out looking at how healthy behaviours support children's health and well-being. And of course, children's health and well-being is a complex issue, a lot to do with the family environment. But we wanted to look at what are simple things that parents could do to really look at how they could support their children.
So give us the list.
Well, one of the lists was on screen time, so that's looking at computers and TVs, over 2 hours a day. We start to see children getting more anxious and worried. And the other areas is physical activity. We know that they take some physical activity that helps with their anxiety and their self-esteem.
Jack, your thoughts on this, because I imagine many parents watching will agree in principle that this is what needs to be done and kids will be more healthy if they're given more time for physical activity. But the reality is that a lot of parents are short on time and leading busy lives.
And also there's a lot of difficulty around finding things that are as cheap and entertaining as TV for children. I mean, all town centres at the moment are feeling cuts with local councils, so parks are being closed, libraries are being closed, there's less access to green space than there was. So I think it's difficult to find the balance between demonising parents for letting their children watch TV. As the report says that over 4 hours a day is excessive screen time, which is linked to anxiety and depression in children. And I don't think that many parents plonk their dearly beloved children in front of TV for 4 hours at a time. So I think a bit of perspective, but also to recognise that it's difficult as a single parent or an unemployed parent or a parent on low income to find things to do with your child.
What are the ways, though, you can perhaps diminish that time in front of the television? I mean, really, you wouldn't really want 3 hours. It's arbitrary, isn't it, the number?
Yeah, I mean, for a long time I didn't even have a TV, and I can tell you they were the most difficult 6 to 9 months of my life, having a toddler and not having a television. You've got to find things to do, you've got to take them to the park, or you start walking them everywhere to use up a little bit of time, you know. But it is difficult, and I think it's quite easy to say that everyone plonks their kids in front of the telly, but it's quite easy entertainment.
Is there a danger, Dr. Hoskins, that you end up sounding like this sort of academic, hovering above, looking down on people's lives, and almost inevitably casting judgment on people by saying what you see is, if you like, clinical fact?
Well, I mean, I think we're at the start of the new school year, and what we're launching today is a campaign, Smart Restart. And when we've talked to parents, they recognise over the summer holidays maybe they've got into some bad habits. So they quite like the idea of starting school, looking at what they can do to just take on one change of habit. And I think one of the things that we want to do is support parents. So we've got this campaign where we're just asking them to look at one thing, and it's about maybe walking a little bit to school, maybe stop if you're going by the bus. Don't take the bus stop just outside the school, take the one before, so you walk a little bit more. Look at what's in that snacks, change a healthy snack. So what we're trying to do is give people tips, and they choose with the parents and maybe their young one, choose, OK, what do we want to do for these next 6 weeks? And then there'll be support for them with sort of emails and text messages to help them. I mean, I was a mother too. I am a mother. My children are slightly older than Jack's. But certainly the screen time, the TV time, I think that's something that's come up over the last few years. And for me, I think parents should know the more screen time, the more challenge there are for their children. But we have to help people, support them, think of different ways of doing it. But
quite often
it's not easy.
Yeah,
I get that.
I was just going to say, Jack, sometimes, I don't know what your experience is, but sometimes the people who, if you like, most need the advice or the help or the encouragement are the very ones who are probably least likely to either hear the message, listen to the message, or do anything?
Yeah, I think that it needs to be targeted well. I mean, I used to attend a children's centre, a Shore Start Children's Centre, and there was a lot of Change for Life literature there, and it was useful. It was the meal and menu planning cards that were there at the time. So I think that if the government is serious about supporting parents and children into doing other things rather than sitting watching TV all day, as the research seems to think we do, then it needs to make sure that its message reaches the right people. But again, back to my point about libraries, parks, green spaces, safe places for children to play. If national government says, well, here's an initiative, children need to spend less time watching television, it needs to be then backed up by local government who stop shutting parks and libraries.
Jack, thank you. Dr. Hoskins, thank you.
Thank you. Coming up on breakfast, it's English, but do you understand what's being said?